I'm Dr. Sasikanth, Senior Consultant Plastic Cosmetic Surgeon. Ingrowing toenail. So, what does that mean, ingrowing toenail? So, what happens in ingrowing toenail is the toenail, what it is, that it grows in sideways and impinging onto the nail fold, the skin of the nail fold. That leads to repeated infections of the nail fold and causing pain and swelling of the nail fold. And this total condition is caused by a tail growing inside the skin. So that is why it is called ingrowing toenail. So what happens if this ingrowing toenail is not treated? So what happens, this ingrowing toenail goes and impinges or pierces or damages the lateral skin fold of the nail, and this causes infections. So what kind of infections we get? We get infection of the nail fold. Nail fold is the fold on the one side of the nail that might become swollen and pus may get collected, or sometimes this infection might spread into the pulp of the fingertip. That is called whitlow. It can cause whitlows. Or sometimes this infection can spread into the nail bed, and sometimes the infection can cause loss of nail. So all these problems, these are caused by the ingrowing toenail. So how do we tackle this ingrowing toenail, or how do we prevent, first of all, to prevent the ingrowing toenail occurrence? So this ingrowing toenail occurs because when we take the nails apart or when we trim the nails not improperly, by either trimming the nail with hand or trimming the nail with a nail cutter, more like going inside, especially on the edges, and damaging the nail fold skin while cutting the nails, like peeling off the nails along with some of the skin of the nail, injuring the nail fold. So in this way, you damage the nail fold or gives a portal for infection, and which may spread to nail fold or into the pulp, leading to pulp space infections or nail fold infections. So this is how the finger ingrowing toenail cause problems to the finger toes. So how do we treat? So initially, if there is an infection or anything, we give antibiotics and we observe for maybe few days or few months, and if there is no recurrence, we will continue. But if the infection is coming again and again, then what we have to do is we have to 4 to 5 millimeters of the edge of the nail from the nail matrix, so that the nail will not reform in that last 4 to 5 minutes or 5 millimeters of the nail. So the nail will not form in the last 4 to 5 millimeters, thereby allowing some space for the nail to grow without impinging or without piercing or without damaging the nail fold. In that fashion, we can prevent the recurrent damage to the nail fold leading to infections or anything. So that is how we treat nail fold infections or ingrowing toenail.